Morning everyone, Shraddha Vasnik here. In today's lecture, we are going to study about the factors which modify the drug action. The factors which modify the drug's action are, there are total 16 factors which modify the drug action. आणि यासाठी आपल्याकडे एक फॉर्म्युला आहे ज्याच्यामुळे आपण ही जे फॅक्टर्स आहे ते रिकॉल करू शकतो किंवा लक्षात ठेवू शकतो. जसे की फॉर एक्झाम्पल सारी मस्ती अँड पापा. सारी मस्ती पापा means S stand for sex, A stand for age and body weight, R stand for route of administration, E stand for environment, second E stand for environment emotional factors, then M stand for metabolic disturbances, A stand for accumulation, S stand for synergism, T for tolerance, then second T for tachyphylaxis, I for idiosyncrasy, then P for presence of disease, then A for additive effect or antagonism, additive effect, then second P for presence of previous drug therapy and A for additive effect. Now, we will see about the age and the body weight. Average dose specified in terms of the single dose for adults. Then, in case there are malnourished patient or nutritional factors, it affects the metabolism of drug, which means it directly affects the absorption, distribution, metabolism and excretion of the drug. According to age and weight of the children, the dose of the children can be calculated as, first is Young's formula and second is the Hamburg's rule. The Young's rule for the children is 2 to 12 years. The formula is child dose is equal to age divided by age plus 2 into adult dose, and Hamburg's rule is child dose is equal to weight in kg divided by 70 into adult dose. Then route of administration. As we know, route of administration means parenterally administered drugs are quickly absorbed as compared to the drugs which are administered through the oral route. Then presence of disease. Drug response alter or changes. In case there is diarrhea, there is increase in the intestinal motility which decreases the drug action. Drug which excreted through kidney or urine, the toxicity increases in case of kidney failure. Then emotional factors. Placebos are inert substances which are given to the patients or the person who are not suffering from any disorder. Tolerance. When an usually large dose of the drug is required to elicit an effect produced by the normal dose of the drug, this phenomena is known as drug tolerance. It takes time to develop and the original effect can be obtained by increasing the dose of the drug, for example barbiturate. Then tachyphylaxis. In tachyphylaxis, when the drug is administered repeatedly at very short interval, the pharmacological response elicited the drug decreases progressively. It develops quickly. The original effect cannot be obtained by increasing dose of the drug, for example, ephedrine. Presence of previous drug therapy. In presence of previous drug therapy, it inhibits the pharmacological action of other drug. Metabolic disturbances. The change in the metabolic activity like electrolyte balance, acid balance, it may affect the drug action. Accumulation. Every drug has its own time of absorption, distribution, metabolism and excretion. If it's slowly excreted, then repeated administration of that specific drug may cause high concentration in the plasma known as accumulation, and the toxicity is known as cumulative toxicity. For example, phenobarbital in the epilepsy. Then addition or additive effect. In this, 1 plus 1 is equal to 2, which means when two or more drugs administered together, the total pharmacological action is equal to the sum of those individual pharmacological action is known as additive effect. Then synergism. In synergism, there is 1 plus 1 is equal to 3. When two or more drugs administered together, the resultant pharmacological action is greater than sum of their individual pharmacological action. Antagonism. In antagonism, there is 1 plus 1 is equal to 0, which means when two or more drugs are administered together, they try to oppose each other pharmacological action. The agent is known as antagonist and the phenomena is known as antagonism. The types of antagonism are chemical antagonism, competitive antagonism, non-competitive antagonism and physical antagonism. In chemical antagonism, the activity of one drug is reduced by another drug by chemical reaction. In competitive antagonism, the agonist and antagonist compete for same receptor and it is totally depends on the concentration of agonist and antagonist. Then time of administration. During the daytime, central nervous system is highly active. Hence, the dose of the barbiturate is required to produce the sleep during the night is less than the dose required during the daytime. Then sex. Drugs like morphine, which crosses placental barriers and depresses the fetal respiration, hence contraindicated in the pregnancy. There is some types of tolerance are natural tolerance and acquired tolerance. In natural tolerance, species tolerance are the rabbit can tolerate the large dose of belladonna due to the presence of atropine esterase in the liver, and the negroes fails to produce dilation of pupil when ephedrine is instilled into the eye. And in acquired tolerance, the repeated administration of drug result into the slow development of resistance to its effect to produce some therapeutic response. It is essential to increase dose of the drug and it is known as acquired tolerance. For example, morphine and alcohol. These are the factors which modify the drug's action, and thank you so much for being there.